Boston, Massachusetts, October 1846. Edward Gilbert Abbott is 21 years old. He is lying on a wooden table on the fourth floor of a hospital, and 3 men are standing beside him, waiting. He knows what they are there for. Everyone in Boston knows what they are there for. A man enters carrying a glass flask. He is not the surgeon, he is a dentist. He sets the flask beside Abbott's head and steps back. The 3 men do not move. This is his case file. For the whole of recorded history, surgical pain had no solution. Alcohol dulled it. Opium dulled it. Neither produced anything close to unconsciousness, and so the surgeon worked on a patient who felt everything. This is why speed mattered more than anything else. Surgeons were ranked by the clock, and the ranking was not vanity. A long operation meant more blood lost, deeper shock, and a greater chance the body would simply stop. A competent surgeon could take a leg off in 3 minutes. The fastest in Britain, Robert Liston, could do it in under 30 seconds. The knife clenched in his teeth between cuts to free both hands. The patient, throughout, was awake, held down by assistants whose only task was to keep the body still while the surgeon cut. In 1811, the novelist Fanny Burney underwent a mastectomy with nothing but a wine cordial. She described it afterward in a letter to her sister. A scream that lasted, she wrote, the entire length of the incision. She marveled, she added, to find it gone. That was surgery. That was the only kind there had ever been. The question carried into the Massachusetts General Hospital on the morning of October 16th was whether it had to stay that way. William Morton was 27, and he was not a physician. He had trained as a dentist, first in Baltimore, then in Boston, where for a time he had shared a practice with another dentist named Horace Wells. The partnership had not lasted. Few of Morton's arrangements did. His interest in painless surgery had begun in the most ordinary way. Pulling teeth hurt, and patients in pain flinched and pulled away, which is a dangerous thing when a man is working with steel inside your mouth. Morton was not looking for a discovery. He was looking for a way to keep his patients from moving. The difference between those 2 things would shape the rest of his life. He had encountered ether before. Diethyl ether, a clear, volatile liquid first distilled in the 1540s, was familiar to him. Not from medicine, but from parties. Ether frolics were a fashionable amusement. A cloth soaked in the liquid, held to the face, produced a few moments of giddy insensibility. People who inhaled it stumbled and fell, and afterward reported that they had felt nothing when they hit the floor. Morton noticed that detail when no one else did. He began testing it, first on his dog, then on himself. In September 1846, a man named Ibn Frost came into his office with a toothache that had kept him awake for 3 nights. Morton soaked a cloth, held it to Frost's face, and drew the tooth. Frost woke and said he had felt nothing at all. Morton wrote to the hospital. The surgeon who agreed to let him try was John Collins Warren. 68 years old, a founder of Massachusetts General Hospital and the first dean of Harvard Medical School. Warren had been disappointed before. The year before, Morton's old partner, Horace Wells, had come to Boston to demonstrate a different gas, nitrous oxide, on a patient having a tooth pulled before an audience of Harvard students. The patient had groaned. The students had jeered him out of the hall. Warren had no particular reason to think this would go better. The patient that morning was the young house painter from the operating table, Edward Gilbert Abbott, who had come in to have a tumor removed from his jaw. Warren had chosen his case for the trial, straightforward and survivable, even if the gas did nothing at all. On the morning of October 16th, Morton was late. Warren had already turned to address the gallery and was preparing to begin without him when he arrived, carrying an apparatus of his own design, a glass globe with a wooden mouthpiece, packed inside with an ether-soaked sponge. He fitted it to Abbott and told him to breathe. Abbott breathed, his eyes closed, his body settled and went still. Warren made an incision 3 inches long beneath the jaw and began to remove the tumor. He did not hurry. He spoke to the gallery as he worked, the way a man speaks when he has time. When he finished, the blood was wiped away, and Abbott was slowly allowed to come back from wherever the ether had taken him. Warren asked him how he felt. Abbott said it felt as though his neck had been scratched. Warren turned to the room full of physicians who had come to watch the dentist fail. "Gentlemen," he said, "this is no humbug." The news travelled faster than any medical discovery before it. Within 2 months, ether had reached London. Within 6, it was in use across Europe. Surgeons who had spent their entire careers learning to cut quickly now faced a problem they had never imagined having. With the patient asleep and still, they had all the time in the world, and they had to learn what to do with it. The morning after the demonstration, Morton filed for a patent. He gave his preparation a name, Letheon, after the river Lethe, whose waters in Greek myth erased memory. He tinted the flask with red dye and added an aromatic oil, so that no one would recognize the contents as ordinary ether, which any apothecary sold for almost nothing. A bottle of ether was not a business. Letheon, he believed, could be. The patent was granted on November 12th. The Massachusetts Medical Society condemned it within weeks. A secret remedy sold for private profit was, they held, beneath the profession. And it hardly mattered, because physicians had already seen what was in the flask. They used ether directly, without the apparatus and without the license, and they paid Morton nothing. He had given the discovery away the moment he performed it in front of a crowd. He would spend the next 22 years trying to take it back. Ether works by interrupting the brain's ability to carry a signal. Inhaled as vapor, it crosses from the lungs into the blood within seconds. It is highly lipid-soluble, it dissolves easily in fat. And since the brain is largely fat, it passes the blood-brain barrier without resistance. There, it acts on the GABA-A receptors, the gamma-aminobutyric acid type A receptors, which are the nervous system's main brake on electrical activity between neurons. Ether deepens that braking action. The signals that would normally carry the sensation of a blade through tissue are damped down before they ever reach the part of the brain that would register them as pain. It happens in stages, and the stages matter. First comes analgesia, where pain fades, but the patient is still aware. Then a brief phase of excitement, involuntary movement, sometimes struggle. Then surgical anesthesia, where the body stops responding to the knife. Beyond that lies a final stage where the brainstem stops driving the lungs and the patient does not wake. Morton knew none of this. There was no science of it yet. He judged the dose entirely by Abbott's face, watching, adjusting the flask, with no instrument to tell him how deep the man had gone or how close the surgical stage sat to the fatal one. He was operating on the edge of a substance he did not understand, in front of 60 men who expected him to fail, and the line he was walking was narrower than anyone in the room knew. What is strange is how long the answer had been, lying in plain sight. Ether had been synthesized by Valerius Cordus in 1540 and inhaled for amusement for 3 centuries. The obstacle was never the chemistry. It was that no one had thought to ask whether a party trick belonged in an operating theatre. One man had asked, and earlier. 4 years before Boston, a physician in rural Jefferson, Georgia, named Crawford Long had removed a tumor from the neck of a patient named James Venable, who felt nothing under ether. Long went on to perform 8 such operations and recorded each one carefully. He simply never published. He wanted to be certain before he made the claim. And by the time he was, in 1849, the claim had already been made by someone else in Boston. where the newspapers carried it across the world. In 1849, Morton went to Congress and asked for $100,000 as the sole discoverer of anesthesia. Two bills were introduced on his behalf. Both collapsed under the weight of the competing claims. Crawford Long had filed one, and so had Charles Jackson, Morton's former chemistry professor, who insisted he had been the one to suggest ether in the first place. When the French Academy of Medicine offered Morton and Jackson a shared prize, Morton turned it down rather than accept half the credit. The patent was revoked. The lawsuits consumed what was left of his practice and his money. He died in New York on July 15th, 1868, of a stroke. He was 48 years old. No royalties, no payment from Congress. Only an honorary degree from Harvard, granted in 1852, as the only formal recognition he ever held. By then, Horace Wells had been dead 20 years. After his humiliation in Boston, Wells had kept experimenting on himself and grew dependent on chloroform. In January 1848, deranged by it, he ran into the street and threw sulfuric acid on two women on Broadway. He was arrested. 3 days later, he was found dead in his cell, having anesthetized himself with chloroform before he died. Charles Jackson was committed to an asylum in 1873 and died there. Crawford Long, who had been first and said nothing, was put on a United States postage stamp in 1940 and named the first anesthesiologist. The word anesthesia itself was coined during all this by a Boston physician and poet named Oliver Wendell Holmes, who had watched the whole dispute from the side. Asked, in the end, who truly deserved the credit, Holmes gave the only answer the record ever settled on. He said it was owed to ether, or either. The amphitheatre on the 4th floor of the Bullfinch building is still there. They call it the Ether Dome now. It has not been used for surgery in over a century. There has been no need to operate in a room built for an audience to watch a man endure it. One question for the comments. Crawford Long used ether 4 years before Morton and published 7 years after him. Does that make him the discoverer or only the first? The next case on this channel, a doctor who swallowed the black vomit of fever patients to prove they could not infect him. He nearly died doing it. He was almost right. This is the sealed ward.